Amanda here again. This time we're studying for PEDS exam, neuro. And I'm just hitting the high points. And this video is on Duchennes muscular dystrophy. And it's also known as pseudo-hypertrophic dystrophy. It's a genetic disorder marked by muscular deterioration that progresses throughout childhood. And the onset is insidious. And the onset occurs generally between the ages of 3 and 5. I've seen 3 and 5. I've seen 3 and 7. And the cause is it's a sex-linked recessive trait. So generally we see this a lot of times in males more so than females, because females are the carriers. It occurs only in males because of a defect in the X chromosome. There's a lack of production of dystrophin, and it results in the breakdown of muscle fibers because the muscle has an enzyme called, it's not really an enzyme, but it's the muscle has dystrophin in it, and with this disorder they lack that component in the muscle, dystrophin. Muscle fibers are replaced with fatty deposits and collagen in muscles, and so the weakness results thereafter. The complications of muscular dystrophy, of Duchenne's muscular dystrophy, it is the most prevalent form of muscular dystrophy, by the way. And death, the complications include death in the late teens to early 20s by cardiac failure or respiratory failure, because again, the heart is a muscle, and then for us to breathe, we need our diaphragm, which is also a muscle. And if you have this progressive disease that's basically breaking down your muscles, then of course your heart and your diaphragm is going to be affected as well. So that's the sad part about it. You also have impaired mobility with this particular disorder, as well as intellectual retardation, which could be possible as well. Now, when you're doing your assessment, the assessment findings for muscular dystrophy, you'll begin with pelvic girdle weakness a lot of times, and it's indicated by waddling gait, or they might fall frequently, cardiac or pulmonary failure, and they might have a decreased ability to perform self-care activities, and there's a delayed motor development. You have eventual contractures and muscle hypertrophy. I think particularly in the calf area, if I remember correctly. Gower's sign or Gower's sign, I'm not sure. I would say Gower's sign is the use of hands to push self up from the floor when rising from a sitting to supine position, right? So when the person is sitting, from riding from a sitting or supine, so when they're trying to get up, they're going to use their hands to push themselves up from the floor instead of just sitting up or getting up like you and I would normally do. They also might demonstrate toe walking or working on their tippy toes. In general, where normally we would walk on, we'd walk evenly on our feet. These people would walk on their tippy toes like a ballerina. Diagnostic test findings. The electromyography typically demonstrates short, weak bursts of electrical activity in the affected muscles, and the muscle biopsy would show variations in the size of the muscle fibers, and in later stages shows the fat and connective tissue deposits with no dystrophin. Right, so with Duchenne's muscular dystrophy, the medical management generally is gene therapy, which is still under investigation to prevent muscle degeneration. They also would promote a high fiber, high protein, and a low calorie diet. Physical therapy, surgery to correct any contractures that might have happened, which would only be for mobility purposes only, and use of devices such as splints, braces, trapeze bars, overhead slings, and a wheelchair to help preserve that mobility as much as possible. With nursing interventions, what we are focusing on is we want to perform range of motion exercises to promote joint motility or joint mobility. And we want to provide emotional support to the children and parents to decrease anxiety and promote coping mechanisms, because it's very difficult to have to go through this as with a child and as a parent as well. You want to initiate genetic counseling to inform the child and the family about passing the disorder on to any future children. And if respiratory involvement occurs, you want to encourage coughing, deep breathing exercises, and diaphragmatic breathing to maintain a patent airway and mobilize secretions to prevent any complications associated with retained secretions. You want to encourage use of a footboard or high-top sneakers and a foot cradle to increase comfort and prevent foot drop. And you want to encourage adequate fluid intake, increase dietary fiber, and obtain an order for a stool softener to prevent any constipation from inactivity, because you know with mobility, constipation is one of the side effects of that. And that's it. What we're going to cover with Duchenne's muscular dystrophy.